Dr. Mike Mineo is the Chief Medical Officer at Millard Fillmore Suburban Hospital in Giraffe Medical Park. He joins us today on Medically Speaking to talk about vaccines. Doc, thanks for joining us today.
Thank you for having me, Mike.
A lot of anticipation in the community about access to vaccine, who should get it, when, how much is coming into Western Europe. If we can, let's just start with why the vaccine is so important as we turn the calendar from 2020 into 21.
The only way we're going to beat this, the only way we're going to turn the wave is by the vaccine. We're better at managing the disease, but that will only get us so far. The only way we're going to really be able to open up society, return to life as normal, to be able to kiss our grandparents, see our grandchildren, is to get the community vaccinated.
Not to get too scientific or too medically oriented though, but if you can, for the viewers who may not be familiar, what does a vaccine do and how does it actually work?
So the general idea of a vaccine is to get your body to produce an immune response to a disease without actually having the disease. There's different ways to do it. The old ways that we would do it is you would take a weak version of a virus, introduce it into your body, or take a fragment of the virus and teach your body how to make it. What's unique about this one is we actually put just a little bit of mRNA, it's called, into your body. Your body makes a bit of the protein on the outside of the virus, and your body actually thinks it sees the virus and triggers an immune response to it. So if you actually see the virus, your body instantly gets an immune response, attacks the virus, you never get ill.
So most people would be familiar with vaccinations when they may have a child, or probably most commonly along the lines of the flu. So with the flu shot and the flu vaccination, there's always that question or the old wives' tale of, am I going to get the flu if I get this shot? That could probably be the same question people have for COVID. So if you can dispel any notion there about vaccines for the flu and as it relates to COVID.
That's a great question. So with the vaccine for the flu, sometimes you'll actually get a part of the flu and may actually get a mild illness. With this vaccine, there's no live virus. There is no way for you to get COVID from the vaccine. With that said, you might feel a little ill for a day or so, but that's your body having an immune response and developing antibodies to the vaccine, but there's no way to get the actual virus from the vaccine.
So there had been a lot of fanfare as we closed 2020 in terms of vaccine making it into the hospitals, into the communities. A lot of talk about needles in arms, but there was also a few different either quote types of vaccines or companies with the vaccines. If you can explain what the differences of the two vaccines that are kind of out there right now.
So right now in the United States, there's emergency use authorization for two different vaccines, the Pfizer and the Moderna. The technology behind them is the same. They're both exceedingly effective. The only difference really is that the Pfizer one requires special handling and deep freezers in order to keep it viable. And also the dosing of the second dose is a little bit longer with the Moderna. But in terms of effectiveness, safety profile, completely interchangeable.
And so for our viewers, Pfizer, Moderna, those are really just the companies or those who have produced it for this reason.
That is correct.
Okay. And what's different with this as well, and you mentioned it a little bit earlier, unlike the flu vaccine, with this, you actually have to get two different shots. Can you explain why that is?
Correct. So when they did the studies for both of them, they saw that with one dose of the vaccine, you did get an immune response, but to get a very prolonged immune response, which we hope will be lifelong, took two separate doses. That was the way they devised their studies. And so that's the way that the FDA authorized it. You might hear that over in Europe and in other countries, they're only doing one dose, thinking, well, you're better off to take a large part of the population and get them some immunity. But the FDA's viewpoint on that is that's not what our studies were designed to do. The studies show great immunity with two doses.
That's great. Let's now talk about the WHO. So there are guidelines out there from the State Department of Health and even the federal government. There's an order of importance in the sense of who needs to get this first. If you can explain what that is, who's involved, and how it's being orchestrated.
So in broad strokes, the New York State Department of Health broke it down into three groups. The first group is frontline healthcare providers. Second group is essential workers. Third group is individuals of more advanced age. So right now we're in that first group, healthcare workers. So even within that, there's a bit of a hierarchy because there's only limited amounts of vaccines. So initially we started off with, in the hospital, the highest risk. That meant ICU, emergency department, COVID units. As we vaccinated members of those areas, we've looked to expand it a bit more and offer it to OB services and other floors. At this point, at least in Western New York, we've mostly vaccinated most of the hospital, and we're willing to consider outside of the actual hospital and ambulatory care environment.
So as you work down that order of who's going to get it and at what timeline, really the reason for the healthcare workforce is to protect them. So people can come to work, we keep them safe and healthy. Let's talk about who's next in terms of vulnerability and why it's important. So who would come next?
So within the healthcare environment, again, it's initially those who are in this building. So medical ethicists, the federal governments and the states said, we have to protect our public health infrastructure as first and foremost. We're making great progress in that in an incredible 3-week time period. Next is other frontline healthcare workers, the doctors in your office, the urgent care workers, etc. The next level will be other essential businesses, the grocery store workers, people who work in FedEx and UPS that are keeping commerce working. So other people who've been required to work throughout the pandemic.
Okay, so you talk about the first responders, you talk about essential workers. There's a large population out there that fits the category of general public. How is that being managed if you're 75 years old and you've had a heart condition versus if you're 45 years old and in great physical shape? How does the public know when it's their turn to get this?
So the federal government entrusted the states to handle distribution within the state. And so New York State has set up a hub system, and the hub within each area of the state is going to help take the resources and determine what's the order in terms of who gets the vaccine. So for this part of the state, we do have a centralized hub, and that hub is going to be working through how do we vaccinate the community. The hub is active. It's already started working with the county to do EMS and other frontline workers, and they are really going to be tasked and charged with vaccinating the public. And they're going to be in charge with not only providing the vaccine, but communicating their plan.
So there's a lot of questions with the general public, I would say. If they have questions or they want to know when that eligibility, comes up for them, is that something that they should go online for? Should they call their primary care doc? How does the average person who doesn't work in healthcare get that information?
This process is moving so quickly that's changing day by day. My recommendation now would be monitoring the webpage of the Erie County Department of Health and the New York State Department of Health. The New York State Department of Health is ultimately in charge, but Erie County Department of Health has been very engaged in trying to help message the community.
So Doc, as we wrap up here, you talked about that 3-week time span. So this is a tremendous undertaking to get thousands and thousands of doses into the hospitals, have staff, then put needles in arms. If you can, give us a sense of how this is being responded to by the employees, and your thoughts or your thanks for those who have come together to put this program together.
What we're seeing is a little bit interesting. We have people who are very passionate and want the vaccine, particularly our medical staff, those who study this, live this. We had to slow them down to make sure we had equal access to everybody. But what concerns us is there's members of our community who are resistant to the vaccine. There are patient populations who have concerns that they distrust for public health systems. Those are the ones who scare us because they're all at the same time most vulnerable. So what really keeps us up at night is to make sure everybody in our community recognizes this vaccine will protect you, your family, and our community. But I also want to talk about the success of this system. It is really incredible to watch how the federal government, states, counties, and hospitals have really come together so quickly to not have the vaccine in the very beginning of December, to having the vaccine, to vaccinating large portions of the vulnerable population.
Dr. Mineo, such good information, such good education. Before I thank you for joining us today, I do want to ask, as we go through these phases and we move into phase 2 or phase 3, promise us you'll come back in a few weeks to talk about how things are going with the vaccination program?
It'd be my pleasure.
That's great. Dr. Mike Mineo is the Chief Medical Officer at Millard Fillmore Suburban Hospital in the DeGraff Medical Park. Thanks for joining us today.
Thank you.